Today, I'm thrilled to announce my plan to lower healthcare prices for all Americans and truly make healthcare affordable again. We're doing things that nobody's ever been able to do. We're calling it the Great Healthcare Plan.
I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. And so it begins. Trump has created his own healthcare plan, you guys. This week, the White House introduced what they're calling the Great Healthcare Plan. The stated goal, of course, is very straightforward. It's supposed to lower healthcare costs for all Americans. And immediately, the reaction split down familiar lines, as you guys already know. Supporters say it will finally take on these companies and the insurers. But then the critics are saying it's going to weaken the protections built in that were already there for Affordable Care Act, better known as what? Obamacare. So let's break this down today and look at actually what's being proposed, what it does, what it doesn't do, and how they compare. Because the truth is, Americans deserve healthcare. We all know that. But neither of the plans are perfect. And both, though, do really adjust and try to respond to a real problem in the United States, the affordable care that we don't get. So they just started this very, different assumptions of how healthcare should work. I mean, if we look at one plan, we have to compare it to the other. And so this new plan is not just centered on expanding coverage, which what Affordable Care Act was. It's more centered around cost control, which is important. It assumes that many Americans already have insurance, though. Not all Americans have insurance. That's a fundamental flaw, Dr. Brown. So these insurances are already too expensive, too disconnected to what real price pressures are for most Americans.
Dr. Sloan, you are right. So let's take a look at the philosophy that drives these four main components of Donald Trump's great healthcare plan. Let's roll the clip.
It'll bring down drug prices 80, 90%, in some cases, just numbers that nobody's ever heard of before. Your prescription drugs will come way, way down. And under this policy, the prices of many drugs will be slashed by 300, 400, and even 500% starting this month at the TrumpRx.gov.
So,
did he just say TrumpRx.gov?
Yeah. So let's get into it, right? The first pillar of Trump's great healthcare plan focuses on one of the most frustrating parts of the healthcare system here in the United States, right? The prescription drug prices. The argument is simple. Americans routinely pay 2 to 3 times more for the exact same medications that patients in other developed countries pay. And so this plan proposes tying U.S. drug prices to what those countries pay. And that's essentially saying that Americans should not be subsidizing the rest of the world in terms of our expenditures on these plans, on these prescription drugs. But for those who've had to choose between rent and refilling a prescription, that message really lands, right? The plan also expands access to certain medications over the counter. So when you are thinking about something like a simple cold, this is going to actually reduce the need for doctor's visits just to obtain any basic treatment. So that could mean fewer unnecessary appointments, lower out-of-pocket costs, and faster access to care. And that's particularly for people with limited time, transportation, or insurance coverage. So supporters view this as a direct challenge to pharmaceutical pricing power. And we do need challenges to pharmaceutical pricing power, right? Drug companies have long operated in a system where U.S. consumers absorb the highest cost. And this proposal attempts to disrupt that imbalance. So critics, however, raise a real concern. They argue that linking prices to international markets could reduce revenue and over time slow innovation and new drug development. Now, the tension is in that core debate, affordability now versus innovation later. And it's just important to note that a lot of that innovation comes from NIH funding of certain studies that have not been funded under the current administration. But what's notable is this. Compared to past Republican healthcare proposals, this is one of the most aggressive positions that we've seen on drug pricing. And this is something that we welcome. So whether it delivers meaningful relief without unintended consequences will just depend on the debate. So Dr. Sloan, I'm not even going to touch the ad for TrumpRx.com. So who's really benefiting again? I mean, nonetheless, right? That message is clear. The era of unchecked drug pricing, which actually wasn't unchecked under the Affordable Care Act. Think about how the price of insulin dropped significantly for the majority of Americans. But anyways, the era of unchecked drug pricing is on the political policy battlefield. What do you think, Dr. Sloan?
I think if you're not going to touch the whole Trump RX, I'm not going to touch it either today, at least. So let's move on to the second pillar of this great healthcare plan by Trump. It's going to deal with the insurance subsidies. So let's roll this clip.
Next, my plan would reduce your insurance premiums by stopping government payoffs to big insurance companies and sending that money directly to the people. Obamacare was designed to make insurance companies rich. I call it the Unaffordable Care Act, with billions of dollars in taxpayer subsidies that helped their stock prices skyrocket over 1,700% as you paid more money for healthcare every single year, more and more. The premiums went higher and higher. I want to end this flagrant scam and put extra money straight into the healthcare savings account in your name, and you go out and buy your own healthcare, and you'll make a great deal. You get better healthcare for less money.
Man, that sounds like an insurance salesman or a car salesman, doesn't it? I mean, even as surgeons, I know that we're not necessarily versed or trained in how to review and negotiate and choose the best healthcare plan, especially with these new guidelines and unforeseen impact. So I'm a little hesitant right now. You know, the choice that would affect not just me or your individuals, the family members, your children, that is going to be really hard for a lot of people to digest and figure out. And everyone's already overwhelmed, right? So, I mean, that's bad business, if you will. We got to ease into this. And I'm sure a lot will change in the next couple of months. We'll be talking about this more. But this is going to be where the biggest shift is going to occur. Under Obamacare, the subsidies were lower monthly premiums through insurance marketplaces, and especially for low and middle income families, you know. So for millions of Americans, these subsidies determine whether the coverage is affordable at all, you know. And so now this great healthcare plan proposes a different approach, redirecting some of the support directly to individuals, potentially through their health savings accounts, otherwise known as HSAs. And so the idea is very much empowerment, and we like that, giving people more control over how their healthcare dollars are spent. But the concern is raised through some of the health economic people that do this all the day, every day, across different spectrums. How is this going to really affect us? So HSAs have historically benefited people who have higher incomes, stable jobs, and disposable income. And that's not most of America, I'm just saying. So without a strong guardrail, this approach may not adequately protect people with chronic diseases, you know, diabetes, hypertension, that kind of thing. And it's definitely going to be limited their financial flexibility. So isn't this more about intent, or is it more about outcomes? So when it comes to cost sharing reductions, say it one more time, cost sharing reductions, CSRs, that's what you're going to be hearing about more. The reality for this being very straightforward, what that is basically under the Affordable Care Act, it's not going to change. It's the same thing. Both systems said this was the silver plan, if you will. It was based off of income. It reduced out-of-pocket spending, and likely the deductibles and copays, but not necessarily the premiums, the major cost of the whole plan, right? So if you qualify, that's a whole nother gamut we haven't even got into. The experience at the doctor's office may look the same, but the real difference is going to be how it's funded. So under the ACA, insurance weren't directly reimbursed, leading to this higher silver plan premiums. It was sort of a get around, if you will. The new plan proposes explicit federal funding again. We'll see. But that could stabilize the market and lower the premiums overall. So it's the same exact tool, you guys, different framing, right? And far more overlapping than most politicians want to suggest. Let's roll this clip.
Next, the Great Healthcare Plan. That's the name. It's called the Great Healthcare because it's great healthcare at a lower price. Mandates unprecedented accountability and transparency from insurance companies and all healthcare providers, so that special interests can no longer profiteer at your expense.
Promises.
promises, and I just want to reiterate some of the facts, right? The Affordable Care Act, also known as Obamacare, expanded coverage and lowered the cost of healthcare for millions of Americans. And the irony is, at the same time, we now have this HHS secretary in RFK Jr. that's using this concept of parent choice as a shield to roll back basic public health protections. So that's really been inviting return of measles, whooping cough. Remember those kids that died in Kentucky? And this is all while the nation is facing record flu levels. Anyway, lest I digress, let's say the third pillar, which is to hold insurance companies accountable. So the plan would require insurers to publicly disclose profit margins, denial rates, administrative costs, and coverage limitations in plain language, something that we all welcome, right? No fine print, no legal gymnastics. And the theory is simple. Transparency creates pressure. So if consumers can see which insurers deny claims most often and spend more heavily on administration instead of care, the markets will respond. And there is this area of surprising overlap because transparency is wildly popular. I mean, the disagreement actually is whether transparency alone is sufficient to change the behavior in that system. And that's in particular important when consumers will lack viable alternatives. So, Dr. Sloan, I thought it was an interesting choice, of this historic quote. Let's roll the clip.
As the saying goes, sunlight is the best disinfectant. That is why my plan orders all insurance companies to publish rate and coverage comparisons in very plain English. It requires insurers to publish detailed information about how much of your money they're going to be paying out in claims versus how much they're taking in profits. In other words, you will be able to watch the scam. It forces them to release detailed data on how many claims are being denied and whether those denials are eventually overturned on appeal. And most importantly, it will require any hospital or insurer who accepts Medicare or Medicaid to prominently post all prices at their place of business so that you are never surprised and you can easily shop for a better deal or better care, and you're going to end up doing both. You're going to get a better deal and better care.
So, the phrase sunlight is the best of disinfectants was actually famously written by the U.S. Supreme Court Justice Louis Brandeis. And the quote appeared in 1913 in a Harper's Weekly that said, "What publicity can do," and later in 1914. And the full quote is that sunlight is the best of disinfectants, electric light, the most efficient policeman. So why did Brandeis say that? It's because he was referring to that statement where this is in a James Bryce book in 1888, The American Commonwealth, that says public opinion is sort of an atmosphere, fresh, keen, and full of sunlight, like that of the American cities. And this sunlight kills many of the noxious germs, which are hatched where politicians congregate. So that which, varying a once famous phrase we may call the genius of universal publicity, has some disagreeable results, but the wholesomeness, or rather the wholesome ones, are greater and more numerous. So what do you think, Dr. Sloan, huh?
I think that's a brilliant quote, but I think whoever picked it didn't realize that it was somewhat very, very much so gaslighting. I mean, it's pulling the shade, right? It's pulling the covers off to people that are being dishonest. And so for him to quote that, I thought that was very interesting, but nonetheless. So the fourth and final pillar in Trump's great healthcare plan is really going to address price transparency across all healthcares, right? So hospital physicians, insurers that participate in Medicare and Medicaid would have to clearly post prices before care is delivered. And the goal would be to end any surprise billing, hidden fees, and frustrations across all party lines, right? So, but critics say that the ACA has long argued that expanding access without fixed pricing opacity, this is not something new. This plan flips that logic, though. Fix the price first, and then let's get coverage afterwards. So let's talk about how does it compare to Obamacare? The Affordable Care Act was fundamentally a coverage of expansion. It was about everyone getting coverage. It focused on guaranteeing coverage regardless if you had pre-existing conditions, or standardizing essential health benefits, care, if you will, expanding Medicaid into all participating states and reducing uninstated rates through income-based subsidies. So, everyone could afford it. That was the whole point. It prioritized equity, stability, and risk sharing. However, the great healthcare plan under Trump prioritizes something totally different: marketplace pressure, consumer choice, and cost discipline. One emphasizes protection, the other emphasizes pricing reform. So here's the honest assessment. ACA significantly reduces the number of uninsured Americans and provided stability for those with chronic conditions, but it did not meaningfully slow the long-term healthcare costs. The great healthcare plan aggressively targets the costs, particularly drugs and insurance companies, but it offers very few built-in protections unless you're looking at legislation filling those gaps. And I don't think we can hold our hat to that. So they solve different problems, if you will, but we still have the problem. So healthcare policy has always been a balancing act. And you guys know that, among access, affordability, and sustainability. But Dr. Brown, if you push too hard in one direction, something has to give. And unfortunately, my concern, and I'm sure your concern, is that it has historically always been the health of Americans.
Exactly, Dr. Sloan. And let's remember, the ACA, aka Obamacare, was meant as a start to the process. It was expanding costs, expanding access and driving costs down over time. It was not the finish line. So the real question isn't whether this quote unquote replaces Obamacare. It's whether lawmakers can reform costs while protecting coverage. And that's without forcing Americans to choose between the two, because illness, again, does not care about ideology. And, families are feeling policy at the pharmacy counter, and in the ER, on the kitchen table, and patients today, experiencing this in practice as I speak, that patients are not accessing care because they don't want to pay their deductibles in the beginning of the year, understandably, and not quite understanding their healthcare plan. So we all benefit from transparency, clear prices, clear outcomes, and clear accountability. And that is definitely the conversation worth having. It's not red versus blue. It's what actually works. Thank you for watching. Stay empowered, stay disruptive, and remember, your voice matters. We are Aya, contributors to the MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.